Good afternoon. My presentation today is entitled Unexpected Increase in Physical Exercise During the First Lockdown of COVID-19 in England in People with Dementia. What are the implications for future community care? So there was an expectation during the first wave of lockdown that all people, and in particular people with dementia, would experience reduced levels of activity. But despite these concerns, very little empirical evidence has been brought to support these concern. This specific study we're presenting today investigates the impact of lockdown restrictions introduced in England in response to the first wave of COVID-19 on the levels of physical exercise in participants with dementia in receipt of PRAISE. PRAISE stands for Promoting Activity, Independence and Stability in Early Dementia. It's a 12-month intervention promoting physical exercise in people living with dementia. We do this through the development of a personalized physical exercise plan, but also through provision of regular sessions with trained therapists. There's a link with further information on PRAISE. So during lockdown, we converted the face-to-face sessions with therapists to delivery through video consultations or the phone. But we asked participants to keep doing PRAISE the same way as before. We also asked the participants to routinely record their minutes of exercise per day on monthly calendars. We use these monthly calendars to compare 3 time points, pre-lockdown, during lockdown, and post-lockdown, to test whether any differences in exercise levels were experienced during these first wave of COVID-19. We involved 30 participants, equally distributed between male and females, and the return rate of calendars was 76%. So we found a statistically significant increase in exercise during lockdown compared to pre-lockdown levels, and also a statistically significant decrease comparing the lockdown period with the post-lockdown period. So these findings kind of defy the expectations of the experience of lower physical exercise levels in people with dementia. We thought about some potential explanations based on the anecdotal evidence that we gather from our participants. And these include the novelty of the first weeks of lockdown, which was followed by the growing apathy as the weeks progressed. We had also an unprecedented warm spring in the UK, which might have motivated people to keep active outside. Some personal variables might have played a role, such as carers moving in during the lockdown period, but also the practical supports that we gave participants through our video consultations were instrumental in keeping them motivated to keep active. This study has great limitations, which is a small sample of just 30 participants, and also the fact that calendars may not be reliable as they're based on self-reported measures. But nonetheless, we wanted to report findings in this conference because we thought they were really interesting and there might be some important considerations for future community care. As we said, the lockdown did not necessarily reduce exercise levels in all people with dementia. Those who had a consistent support, either through PRAISE in our case, but in general, maybe through caregivers, actually were able to keep exercise levels and in some cases to even increase them. But of course, not all people with dementia have that support available for them, both in situation of social distancing, but also in normative circumstances. So it is crucial for the community, for policymakers and clinicians to find ways in which we can actually support all people with dementia to maintain physical activity at home. We had some rehabilitation experiments during the pandemic, and these have shown that there could be new, effective, and innovative approaches to support people with dementia to keep active. Our own experiment was about telerehabilitation, which has shown promising results, as I will report on in a different oral presentation in this conference. There's a link here to a study that we've done, but we found also that telerehabilitation at the moment has great issues of inequality of access, and these must be acknowledged and addressed before the process can really be equitable to all people with dementia. So thank you for your attention. I will now take questions if there's any.